So there's no greater honor in our field than to be named the Maury Collen Award winner.
I've known Charlie for many, many years. He's always been a brilliant fellow, hardworking, I would say good-natured and inspirational.
I can't think of anyone better deserving of this award than Charlie Safran, and I'm just delighted that he's getting it at this point in his wonderful career.
I think his contribution is unique. Some people are special, some people are unique, and I believe Charlie has both.
He's genuinely made international contributions to goodwill, as well as obviously the progression of the discipline.
Charlie tends to see things before other people do, and he is very good working with people.
So I called Maury and I said, guess who's gotten the Maury Collen Award for 2014? He said, well, who is it? I said, it's your and my buddy, Charles Safran. Charles Safran? He said, he really deserves it. He made this a medical specialty. It's now a clinical informatics specialty. So now I'm 100 years old and it's happening. So please tell Charlie I am thrilled and he has my full blessing and hearty congratulations.
Charles Safran made his world debut February 3, 1951. Growing up in the New York City suburb of Metuchen, New Jersey, he was the middle child of three and says life in the 50s for him was much like the TV series Mad Men.
As a child, I was pretty curious about electronics and particularly interested in the electrical sockets around my house. I used to stick wires into them to see the sparks.
And that curiosity led to his taking apart a small black and white TV.
I had a solder gun, and I basically took every cathode ray tube out of the TV and lined it all up on the floor, and then wanted to put it back together again. My mother wouldn't let me, and she basically threw it all away at that point. So suppose I had a pretty normal childhood. Wasn't particularly a good student. Had a lot of good family time.
As it turned out, by high school, young Charlie was pretty good in geometry and attended a National Science Foundation training program at Ohio State University.
Allowed me for the first time to both explore number theory, which was the nature of the summer program, but also to really realize how bright some people were, and that among bright people I was only average.
When it was time for college, young Mr. Safran chose the engineering school at Tufts University, which lasted all of about 6 months.
I realized that what I liked was theoretical math. So I transferred into the liberal arts program. I finished my undergraduate and graduate courses before completing the required liberal arts requirements to graduate as an undergraduate.
Charlie's advisor at the time suggested he go over to MIT and check out their work in the Artificial Intelligence Lab, where he joined a new group working on medical decision-making.
I was the first programmer of the MIT's medical decision-making group.
But Charlie's career path had not yet solidified. He had worked with a number of physicians while building early decision support systems at the New England Medical Center, which was part of Tufts Medical School.
And I sort of realized that it was a bad idea, at least from my perspective, to work for doctors. It was better to be one of them.
So Charlie was accepted into medical school at Tufts, and the spotlight found him rather quickly.
During my first year of medical school, the work that I had been doing with Dr. Jane DeForge at the New England Medical Center on staging patients with Hodgkin's disease was published in the New England Journal of Medicine.
While completing his MD in internal medicine, Charlie was training at the VA hospital when an article in the New England Journal of Medicine caught his attention. It was about paper chase, self-service searching of the biomedical literature, which was all but unheard of in 1982.
Two things hit me at that point. One is that I needed to go and speak with the people that had written this, because it was clear to me this was going to change my life as a physician. And the second part was that I really wanted to work with these folks who had done this, because I thought it was a pretty amazing innovation.
So our intrepid young physician went to see Dr. Howard Bleish and Dr. Warner Slack and just happened to be at the right place at the right time.
They were forming something, an entity called the Center for Clinical Computing at Harvard, and I became their director of research over the next several years.
Well, one of the early things that Charlie did was to bring into fruition his vision back in the 1980s of a medical record on a computer. And the basic technology that was deployed by him and by his colleagues back then is still in use in our hospital today.
And one of the things that we did in those days was to build alerts and reminders into the system. We were able to show that clinicians responded 5 times more rapidly and more than twice as completely to the alerts and reminders than when we just let them practice without any clinical decision support.
The online medical records at Beth Israel Deaconess is now web-based and used in 70 ambulatory clinics.
This couldn't really have been done without the pioneering work of Howard Bleish and Warner Slack.
He's been, over the years, a dear friend of mine and a highly valued colleague, really doing seminal work, very creative. He has had many, many ideas as to how to develop and study good computing that would help the doctor and the patient.
I think in those days, many of us believed that electronic health records, although we didn't call them such at the time, but the computerization of healthcare would be well accomplished by the year 2000.
In 1986, Charlie found himself on a panel that included Dr. Jean-Rel Scherer of the University of Geneva. They became friends, and Charlie invited Dr. Scherer to Boston.
Out of that relationship, he invited me to be a visiting professor at the University of Geneva in 1990. And I spent 6 months there and got to meet not only many people in Geneva, but was encouraged by Dr. Scherer to go to Paris to meet Patrice Degoulet, who's been a lifelong friend, and also was privileged at that first meeting to meet with Dr. Francois Grémy, who some say is the grandfather of the field. He's certainly a seminal figure and is credited with actually naming the field of medical informatique.
That experience in Geneva and Paris triggered an international awakening with personal enlightenment and ongoing satisfaction for Dr. Safran, which has taken him literally to the 4 corners of the globe.
And have gotten to know many of the leading informatics professors and colleagues in many countries. I have had the privilege, because of that, of having a number of people from Korea, from Israel, from Brazil come train with me. Dr. Hamar Marin is one of those people who is from Brazil, is a leading nurse informatician, and has become a long-time personal friend as well as a professional colleague.
And I came to be his fellow in '96. I spent 2 years and a half with Charlie, and then 2008 I came back again, now as a visiting professor. I felt I was received as a family member. I was received by Charlie and Donna and the girls, and they put me inside the family like an adoption, so it was great.
One of the early pieces of work that I did with Charlie as a fellow was to build a website for patients who were undergoing surgery to help reduce their pain. And that was a fabulous experience, and through his vision and leadership, we were able to do that back before this was really a common practice.
Charlie has graduated over 20 outstanding people who've gone on both nationally and internationally to distinguish themselves in their own careers.
And because we didn't have a lot of fellows, it was me and the programming staff. So we did a lot of fantastic projects together. I think that Charlie has a great way of thinking strategically and thinking about the big picture and sort of seeing where things need to go. And it's almost like he's playing chess. And he's really good about trying to figure out what the next thing is that's necessary.
Charlie's international globetrotting exists within a solid framework of family. You see, wife Donna and daughters Rachel and Julie have shared in the bulk of those trips, making them a shared cultural experience.
Colleagues in the countries that we visit have become friends. We've been able to visit their homes. My children have been able to meet some of their children, and to get to know a country in a way that and a culture in a way that you can't know just as a visitor.
Charlie met his wife Donna when he was a fourth-year med student assigned to the emergency room at St. Elizabeth's Hospital in Brighton, Massachusetts. Donna was the hospital administrator in charge of the outpatient area.
I awkwardly think I mentioned that she had mayonnaise on her chin one day in the cafeteria, and which is how we got to meet. We have had a wonderful marriage for 33 years at this point, and we have two wonderful daughters, and both my daughters now are married. We have one grandson and one granddog, and one more grandchild on the way.
In 1996, the National Library of Medicine was inviting proposals for projects that could demonstrate the viability of telemedicine. And Charlie got a grant for what he called Baby Care Link, an audiovisual umbilical cord between parents and infants in neonatal intensive care.
We proposed using the internet to have video conferencing between the home and the neonatal intensive care unit.
Kind of a simple idea, but one that's pretty hard to do, but one that essentially helped the parents, I suppose the mother in particular, bind to this child who was in a sense left behind because of the need to stay in an intensive care unit.
In 2004, Charlie assumed the leadership mantle of AMIA with an eye toward raising the organization's visibility and thus its clout.
I was instrumental in convincing my fellow board members that we should hire a senior informatician as our CEO and president, and was lucky enough to recruit Don Detmer as our first CEO and president to help change the course of AMIA.
Well, what we wanted to do was to try to bring AMIA from sort of everything in the U.S. is sports metaphors now, from a club sport to a varsity sport.
And that's really enabled the organization over the past decade to move to a different plateau of success.
Part of the new AMIA, as envisioned by Charlie Safran, included a quest to have one doctor and one nurse trained in informatics in every hospital in the country. And that led to AMIA's 10x10 program and a professional certification of medical subspecialty for physicians.
We had to better understand what the home environment was, what were the kinds of concerns that patients had. And so it was pretty clear to me that the people that knew about this kind of aspect of making people well or keeping people healthy were nurses.
It's essential. It's not just a good idea. It's essential. And we are 24/7 at the side of the patient. So Charlie had that vision.
It's been wonderful to watch his evolution and progression as well, because he's just had more and more good ideas over the years and has contributed in more and more ways to our division.
He does take himself seriously, and I think when he commits to something, he will drive to that, and he will not always be totally friendly as you try to get there, because he wants to see it done. And actually sharing that kind of mindset made us, I think, easy workers together.
Sometimes I think I'm lucky to have been at the right place at the right time with the right people. And so many of the things that I get credit for or am associated with were really enabled by being with Dr. Bleich and Dr. Slack.
Charlie, you did a great job. This award that you're being given is well deserved. You should be very much proud of what you have accomplished.
Charlie, congratulations. Well done. Richly deserved. It's so much fun for me to see you getting this wonderful award that you deserve so richly.
Congratulations to you and also your wonderful family. It's a privilege to know you. You are truly a man for all seasons.
On behalf of all international fellows you had, we are very proud and very, very honored to be here. Congratulations to the award, and we will continue to follow you. Okay?
I would like to extend a sincere thank you for being such a great supporter, a collaborator, and a partner for all of your nurse colleagues. Congratulations.
Charlie, congratulations on winning the Morris Collen Award. What a terrific and well-deserved honor for you.
Charlie, congratulations on this well-deserved award. It's wonderful to be a part of it, and I want to thank you for really how you've also made my life in informatics more meaningful. Congratulations and best wishes going forward.
Well, Charlie's always been qualified, but we just finally caught up with the reality that he ought to be getting the award, and I'm very glad that he is.
We can't do what we do without the support of our families. That my wife has been there supporting me and taking care of our household and our children and me. And a lot of my ability to help change healthcare is that I have such strong support at home.